So I'm really thrilled to be discussing with everyone today. Really excited to talk about knowledge synthesis for knowledge users. And this is a topic that I'm really passionate about because I strongly believe in providing knowledge users. And when I say knowledge users, I'm talking about patients, healthcare providers, so individuals like clinicians, medical doctors, physiotherapists, occupational therapists, etc., as well as policymakers and health systems managers with evidence to support their decision making. So today I'm going to be discussing the importance of knowledge synthesis, or KS, for decision making by knowledge users, or KUs as we often abbreviate the term. And this builds on the excellent webinar that was given last month or the month before by Dr. John Lavis, where he was talking about the importance of knowledge synthesis for policymaking. So this presentation actually flows nicely from that one. And also will lead nicely into the next webinar next month, where I'll be talking more focused specifically on scoping reviews. But today I'll be discussing the different types of knowledge synthesis, as well as I want everyone to start thinking about how can we select a knowledge synthesis method for a particular research question that was posed by a knowledge user. So let's say a knowledge user comes to us and they have a really important decision they need to make, and we need to work with them to shape their question and then determine which method that we would be able to use to help them, provide them with the information that they require. So first I'll begin by describing what knowledge synthesis is. So this is a definition that I like to use. It's from the Canadian Institutes of Health Research. And the reason that I like it is that they discuss how a synthesis needs to be reproducible and transparent. So this makes us, think about, we have to really make sure that we report all of our methods in a reproducible and transparent way. And I also like this definition because they say that knowledge synthesis isn't just about systematic reviews and meta-analysis, right? It's actually above and beyond and include many different methods, and it can include mixed qualitative, quantitative, as well as solely qualitative methods. So when we think about knowledge synthesis in decision making, there's many different reasons why it makes sense to provide a knowledge synthesis product to our knowledge users. So one main reason is that if we base our decisions on expert opinion, this may actually be misleading. So experts such as clinicians can be 10 years behind on the latest research. They may not mention effective therapies, and they may actually recommend ineffective therapies. So there is some evidence to suggest that basing our decision on clinical expert opinion may actually be biased. And as well, if we base our decisions on one study, it might actually be misleading. And some really important work by Dr. John Ioannidis, he found that 30% of highly cited clinical studies were contradicted or had a reduced effect size in subsequent studies. So knowledge synthesis can be used to make sense out of the results of many different studies in a way that knowledge users can use. So a lot of our knowledge users, so our patients, healthcare providers, policymakers, our policy analysts, our health systems managers, they don't have the skills to summarize the evidence, to sift through all of it, to even know if it is at a risk of bias or not. So this really helps them by providing this product to them so that they know not only what does the evidence say, but how accurate and reliable is the evidence. And it's really difficult for our knowledge users to keep up with the literature, right? So we have 75 randomized trials and 11 systematic reviews published per day. So it's really important for us to be able to summarize this information for them. As well, we can statistically combine the results. So this is what I'm talking about is meta-analysis. and this will increase our confidence in the results, and it increases both power and precision. So when we do a meta-analysis, we have many more studies and many more patients. So we're a bit more confident in our results. And we can also use knowledge synthesis to sort through the results from many conflicting studies. So let's say studies that are done on the same topic, but they come up with different results. So why is that? Is it the difference in the methods that they use? Is it different because they had used a specific population? Is it different because they perhaps found different studies between the different reviews? So it will help us make sense of that as well. So we can use knowledge synthesis to justify why a new study is necessary. So for example, with our Canadian Institutes of Health Canadian Institutes of Health Research, in order for us to get funding for a randomized trial, we actually have to do a systematic review and show them that, you know, we're not sure about whether this intervention works or not. Perhaps the previous studies were underpowered. Perhaps, you know, it's a new intervention, and we need to do this randomized trial in order for us to progress the field and determine whether this intervention works. And also, some journals request when you do a randomized trial that you actually do a systematic review and put your point estimate from your randomized trial into a meta-analysis to show how the field has changed now that you've done this randomized trial. So when we think about the pyramid of evidence, in particular for interventions, we see that the very top of the pyramid in terms of quality of evidence is a systematic review and a meta-analysis of a randomized trial. So when we start thinking about knowledge synthesis and the different types, there's actually many different types out there, and I think most of us are the most comfortable, or maybe I'm the most comfortable, with a systematic review, right? So we have our Cochrane collaboration, we have our Cochrane handbook. You know, these methods have been established for 25 plus years within health. But there actually are many different types of knowledge synthesis that we can use to address the needs of our knowledge users. So today I'll be discussing these different types by putting forth some definitions as well as some examples and letting you know which method, you know, is the most appropriate or could be the most helpful for a particular topic. So now I wanted to pass it on to Arun and his team to give us an example of a knowledge synthesis project that they actually worked on in the past, to give us a real example of, you know, a knowledge synthesis that they did for knowledge users.